and welcome to Yes to Healthy Life Show, which is a health talk show which educates us on various health issues that affect our daily lives. My name is Christiana, and as usual, I'm your host for this educative program. And I hope you share, like, and invite others to join us tonight. We are here to educate ourselves on a very, very important topic, which is brain cancer. I mean, brain cancer. And without wasting much of your time, um, I would like our guest to introduce himself and then we take it from there. Hello, Doc. Can you please introduce yourself to our viewers out there, please?
All right, hello. I feel privileged to be on this platform. I am Dr. Mohamed Hadi Abdallah, and I'm a neurosurgeon who works with the Kolebu Teaching Hospital, and currently I'm at the neurosurgery unit. Yeah, and I'm married with 2 children, certainly, yeah, and have special interest in neurovascular and neuroendoscopic surgeries.
Okay, thank you very much once again for taking your time to come out here and educate us on this important topic. We always hear of cancers, different types of cancers, but brain cancer to me is new to me, and then maybe might be new to others out there. When we talk about brain cancer, what is brain cancer?
Okay, so brain cancer, um, I would answer that question by first explaining what we mean by brain tumor, which is very common as compared to like brain cancer. So a tumor is an abnormal growth in, in any part of the body, and usually is when it is described as a cancer, it means that the rate of growth of that tumor is very high, and the tumor also tend to have certain characteristics such that apart from the rapid growth of the tumor cells, it tend to also infiltrate or affect other cells or tissues around it. So when that happens, we say that we have a cancer. But of course, we have what we call the primary brain tumor or primary brain cancer, where the cancer itself or the abnormal growth is arising from the brain itself or the substance of the brain. And then we have the commonest one, which are actually cancers which had spread to the brain. And a very common one in females, especially in uh, our part of the world in Africa, is breast cancer. Okay, where we have a lot of breast cancer. And now that we have a lot of women surviving because of the improved methods of managing breast cancer, we're beginning to have a lot of brain tumors uh, from people who survive breast cancer. And then secondly, for males, we also have the prostate cancer, which tend to go to the bone, especially the skull bone, and then in some cases also to the brain. In where you reside, where you are in Europe, and especially among Caucasians, we also see it very common in those with lung cancer and then renal cell. So those who have kidney cancer and then lung cancer. So smokers, for example. And one of the very common metastatic cancers also to the brain is what we call more melanoma. Okay, we have melanoma where it's a form of like a skin disorder. One common name which comes to mind is Bob Marley. And such tumors are very aggressive and can also go to the brain. And so these are cancers of the brain. Okay, but because of the peculiar and special nature of brain tumors, we tend to use what we call grade, the grade of the tumor. So there are some tumors which are cancers, but they are low grade, meaning that their rate of increase in size or growth is a bit lower. Okay, and their infiltration is much lower as compared to the ones that we say they are high grade, which are like grade 4. Okay, and the very common brain tumor, uh, which is described as a primary brain cancer, is what we call the glioblastoma multiformis, which has a very poor prognosis. One of the common people who died from that tumor is Ted Kennedy, the popular U.S. senator, the brother of the former U.S. President um,
Yeah.
John F. Kennedy. And the prognosis for that tumor, when you are diagnosed with it first, um, is about 13 months averagely, the survivor. And in Africa, it's as low as 6 to 9 months. And that's the most devastating brain cancer that we know. And brain cancer is very common. It occurs in children and occurs also in adults and the aged. There are peculiarities to the brain cancer. There are certain cancers which occur mainly in children, and there are some type of brain cancers which are very common in a certain age group. And then there are certain brain cancers also which are common in the elderly. So when it comes to brain cancer, it cuts across, and there are children as young as 6 months who have been diagnosed with with brain tumors. Yes.
Wow. Okay, thank you for that. So you've mentioned a few of these cancers. These breast cancers and then this prostate cancers. How are they related to the brain cancer? Yeah.
Okay. So yes, this and I understand your question very well, because these are organs or tissues which are very far away from the brain, but the blood circulation carries food, as well as in this case cancer cells, to other parts of the body. And the brain has a protective system which we call the blood-brain barrier. Okay, which we call the blood-brain barrier. And it has been found that in some of these patients who tend to have these uh, cancer spreading to their brain, one, the blood-brain barrier is broken. Okay, and because you have blood which has passed through from the heart, coming from other parts of the body, being pumped to um, the brain, which is an important organ where blood really goes to. Some of these cancer cells are able to go there, and because of the disruptions of the blood-brain barrier, or in some cases, the tumor itself modify itself such that it is able to actually outwit the blood-brain barrier and is able to go uh, to the brain. And I'm sure when we come to treatment, I'll be mentioning this blood-brain barrier again, which is supposed to protect us. But in certain cases, infections are able, cancers are able to outwit it. And when they get there, it becomes challenging for also for us to treat it.
All right, thank you. So how do you, as a neurosurgeon, diagnose someone with this cancer?
Okay, so it's really starts with um, the presentation of the person or the symptoms and signs. But I must say that in some of the tumors, depending on where they are growing from, it may take long years, sometimes 10 years, for us to detect.
Oh,
And usually by the time these patients come to the hospital, the tumor has grown so big. But in children, usually it would start very early. Some by 6 months they already develop the tumor. But in most children, we have two main peaks. So the age of 3 years, and then we have another peak of 9 years. That's when it's usually occur.
Wow.
And some of these children may have um, some whitish patch on the sclera or in the cornea. You may just identify some patch on the eye. Or if the child cannot speak, the child may be having what we call head tilt. And in UK, they have a very nice guideline which helps even GPs to be able to detect some of these things, because the child may not be able to speak out, But when the child begins to have like a head tilting to one side, then you have to be very careful. It could be a tumor, or their gait, the way they walk may change. A child who was walking normally, all of a sudden we will begin to like walk like a drunkard. Okay, and
Oh,
those are early signs that needs like to be picked. And sometimes they can be very subtle, to the extent that the child may walk very well. You may not pick this uh, imbalance in their walking, but when they are doing sports or they are engaged in some activities with their friends, they tend to fall quite often. Okay, those are important signs also that we need to pick. And then when they reach the age that they can speak, um, they may complain of headache. And
yeah.
unlike adults, when an adult complains of headache, usually want you to be very persistent. In children, when a young child at the age of 2, 3 years can open the mouth and tell you, I have headache,
Everything.
it means that the child is in severe pain. It's in severe pain, and it must be taken serious. It is. It could be a brain tumor, a brain cancer. All right. So there are some also children, by way of um inheritance or hereditary, they might have inherited certain genes from their parents, and they tend to have certain skin disorders. Some may come in the form of patches, or may come in the form of like various lumps, or if you examine their um, armpit, we have what we call like skin freckles. And that is a sign of neurofibromatosis. Okay, neurofibromatosis um, tend to affect the nerves, including the brain, and they tend to have multiple uh, brain tumors, including in some cases the spinal cord. And there are other families also who tend to have other conditions called the von Dieperhausen syndrome. There are some with called Weber's, where they tend to have like port wine stains on their faces. So all these also conditions called the neurocutaneous lesions manifesting themselves first in the skin tend to also have like brain tumors as well. When you come to the adults, from maybe 18 years to 40 years, there are also specific cancers which tend to affect them as well. And for adults, when an adult has headache, okay, if the headache is persistent, and the headache is persistent, and it is focal, meaning that it always occurs at one place. If it's focal, it's persistent, and tend to worsen in the morning. So when the patient comes to the hospital, or if you're at home listening to us, and the headache tends to occur more at dawn, when you are lying down in bed, or early in the morning. And in some cases, the patient wakes up in the morning and begins to vomit. Okay, and when they vomit, they get better and are able to do their daily activities for the day. That is a sign of brain tumor. Okay, they will be fine during the day, only to come and sleep at night, and getting towards 4 a.m., 5 a.m., and then the headache becomes worse, and they wake up with vomiting. Now, when an adult also presents with seizure, in Ghana, some call it convulsion, but convulsion is a bit different. But seizure, when you have some abnormal rhythmic movement of the body. If it happens even once in an adult, it is a very significant presentation, and that adult must be investigated also for brain tumor. So one episode of seizure is in an adult is very significant. And then when we also have like weakness in our body, the weakness could be from the face, for example, the face where the person is unable to close one eye very well or open one eye very well. It could be a tumor which is impinging on a particular nerve. If there is asymmetry in the face, where one part of the face tend to have deviated, it could be left or could be right. That could also be a sign of tumor. When you can't smell, I know in COVID we are talking about smell, but of course, um, there are some there are some tumors. Very common one we call the olfactory groove meningioma, and it begins in a capacious area where there's a lot of space. So when it starts,
Yeah.
the first thing it affects is your sense of smell. Okay, so if
Smell.
you don't
Okay.
have catarrh or what we call flu or nasal congestion and you are unable to smell very well,
Yeah.
apart from COVID, you should be thinking of a brain tumor. Apart from that, when um, you are unable to also see very well from objects coming from your side. Okay, so there are people who are driving, even though they can see very well, they can read straight. But when objects are coming from their side, they are unable to spot it. And very typical for those who drive car, they really have to like stick their head out of the car to be able to see an oncoming vehicle or whoever is coming from the side. That could be a sign of a brain tumor. And for that adult, he must take it serious. And then when you have this progressive loss of vision, okay, and this goes to even doctors and GPs as well. When a patient comes to you and the vision is going down progressively, okay, it could be a sign of brain tumor. There's a tumor we call the pituitary tumor. And some of these tumors in ladies may be associated with amenorrhea, or they will be unable to uh, have the abnormal menses. Okay, so the menses may not come at all, or they may be discharging milk from their breast, or they may be having signs of diabetes. They may be urinating abnormally. Okay, and because this is an area of the brain which is responsible for controlling the secretion of hormone called the pituitary gland, it could manifest in all these forms. Um, and then, as I mentioned, you could also have these skin disorders. If anybody with neurofibromatosis or these neurocutaneous lesions, we should always be monitoring them for brain cancer. And then when somebody also develops a weakness of one part of the body, like a stroke, especially in the very young people, where the patient is unable to move either one hand or one leg or both of them on one side, that could also be a sign of a tumor. The last one that I'll mention, brain cancer is quite big. The last one I'll mention is when you begin to choke on your food. Okay,
Yeah.
when you begin to choke on your food, it could be uh, a sign of a tumor in the brainstem. And as this tumor progresses, it may even result in your inability to breathe. And remember, the brain is, I always call it the master gland. It controls everything. It controls everything, including your heart. The way your heart beats, it is the brain which controls it. So once anything wrong with your brain can affect, and because it is like the master organ, depending on where the tumor is arising from, it can present to you like some diseases, uh, from a particular place. But when the patient is properly examined, you can tell that it is from a from the brain. Now, to of course, all these things are symptoms and signs which are suggestive of brain tumor. But to properly make the diagnosis, you need what we call neuroimaging, and the cheapest one that you can do is a CT scan. But if you are thinking of brain tumor, you must do a CT scan with what you call contrast. So you must be injected with a particular chemical called the contrast. Of course, in those with kidney diseases, we have to be careful giving them a contrast. But you cannot investigate somebody for brain cancer without giving contrast if you are doing CT scan. Now,
Yeah.
the gold standard though is to do the MRI scan. The MRI scan is the gold standard in terms of ionizing radiation. It is safer, but of course, there's also a downside of it for claustrophobic, those who are scared of being alone in one place. And it takes a longer time to be able to acquire an MRI. And in Africa, it's extremely expensive. It is unavailable in some part of the world. So for those in Africa and are practicing and probably listening to us, your best bet would be the CT scan with contrast, but never request a CT scan without contrast if the you suspect brain tumor. But in England and in those listening to us in other places where they have these facilities, the brain MRI is the best form of making this diagnosis. So you can see
Okay.
brain cancer is
So
very expensive, right?
yeah, yeah, very. I have a question. What about
Hmm.
people who have like migraines? Should it be a concern for them to go for this CT scan or this MR, whatever scan? Yeah,
MRI. Yeah, for those with
yeah,
migraine, there are those with known migraines. It has a period that it comes, but such people must see neurologists. Migraine initially, if you are a doctor and you suspect migraine, you shouldn't be treating it. First, send the patient to the specialist, the neurophysician. Let the neurophysician listen to the person's story. As you listen to the person's story, you may be able to tell whether it's a migraine. But really, if you're an adult and you tend to have persistent headache, it is advisable that that adult should have a CT scan at least with contrast. Once you've done that and you don't find anything, there's likely to be migraine, and then you can characterize the migraine that you are thinking of. But nobody should stay at home or be attending to uh, by his GP. I've been having headaches, and only to be told that oh, it is migraine without really doing imaging of the brain. It is very, very important because, as we have mentioned, some of these tumors could have been growing for like the past 10 years in the head of the person. And one thing about brain tumor is that the smaller the tumor, the better the outcome. As the tumor grows, as we have demonstrated, the brain is the master gland and has nerves all over it. These nerves, some control your breathing. If the tumor is not picked early and it tends to um, engage or affect the nerve that controls your breathing, by the time they get you to the hospital, it should have been a bad situation. Now, that is not the
yeah,
only case. Sometimes when they grow so large, the surgery itself then becomes risky, and the patient may not be able to wake up out of the ventilator after the surgery. So persistent headaches should be taken serious. And when they are especially focal, we should take it serious. And my take home advice to everybody listening to us, including doctors, is that if a person comes and you suspect migraine and these headaches have been going on for a long time, you will not lose anything by letting the person do CT scan with contrast. If you are scared of ionizing radiation, you should do an MRI scan.
okay, yeah. Thank you. So, with these cancers, are there any cure or do you have any medication that you give to the patients when they come to you?
Yes, it depends on what we are dealing with. So let me start, for example, for the childhood cancers. Most of the childhood cancers, they need to have operation. We don't have any medicine which will be able to sort them out. And when you are operating, you must make sure that you try and take all the tumor out, especially for children who are less than 3 years, because um, radio therapy tend to destroy their growing cells and sometimes cut off their potential growth. For those ones, surgery is the mainstay of treatment. Okay, but in certain cases, yes, when the child is more than 3 years, we can give radiotherapy for certain tumors or chemotherapy. Um, there are also certain type of childhood cancers that will inject certain chemicals into the tumor itself, which is not the same as like performing surgery. Now, when it comes to the tumors affecting the pituitary gland, which will lead to blindness, or in some cases lead to infertility in women, there's a particular type of the pituitary tumor which tend to respond very well to a medicine uh, called, we have carbagoline, we have bromocriptine, um, which can be given to those distant patients by the endocrinologist. So those patients are managed by the physicians until there is a significant, say, mass effect leading to maybe some form of loss of vision or impairment of the vision. That is when the neurosurgeons come in. So the tumor called prolactinoma also respond very well to medication. But generally, if the patient has headache, you have to give the patient very good painkillers. If we do the studies, that's the imaging of the head, and we see that there's a lot of swelling around the brain. There are certain medications that we give to try and sustain the person, to reduce the headache and keep the person alive. Now, when the headaches in such people become persistent, okay, leading to vomiting, it is a danger sign. They are warning signs. That is imminent death. It means that that person can die at any moment because the pressure in the head is going up. And that is what blows the head, gives the person severe headache. And it is so debilitating. Then as it continues, get to a time that the patient finds it difficult to breathe. Because when the pressures in the head goes up, what happens is that the brain begins to find a place to where it can actually slide itself into. And most of the areas we tend to suffer is the brainstem, which controls your heartbeat, controls your breathing. So when there's so much pressure on the brain from the tumor, these are the areas which suffers, and we can easily lose the patient. So when they come, especially in Africa where we don't have a lot of space for brain cancer, we tend to put patients on some of these medications to try and control the pressure. But this is a temporizing measure. What it means is that within few weeks to a month, you must operate on this patient. If you do not operate on this patient, the patient may end up with a permanent, what we call neurological damage. Maybe you lose the vision completely. And once you lose your vision from these brain tumors, you are not getting it back. It is gone. Even after the surgery, you cannot get it back. In some cases, the patient may die even before the surgery. So, and poverty and lack of neurosurgeons across the world are some of the things which actually contribute to these unfortunate circumstances that many patients find themselves in.
Thank you. Okay, so with this, if after the surgery and then these therapies, yeah, won't they have any side effects like through this chemotherapy and all those stuff?
Yeah, I'll answer the question about chemotherapy. That there's a myth and misnomer that I need to mention before we go, if maybe we may not even get the time. It's about surgery for brain tumors and generally cancers involving the central nervous system, including the spinal cord. Now, with advanced technology and with advanced improvement in the knowledge that we are able to remove tumors and patients are able to go back to their normal activities. So that old myth and misnomer about brain tumors that how can you open somebody's brain and the person will be normal again? No, there are many people who have had brain tumors, we've operated on them, and they've gone back to work. They will have their normal memory, they will be able to think for themselves. Doctors, there are musicians who have all had cancers and they've gone back to. So I want to assure everybody and people not to believe in those myths. There are people with spinal cord lesions as well, even though I know we are not speaking about spinal cord. But all those people now can be operated on unless you stay home very late. And unlike all other cancers that we have in our body, if you come late, your chances are poor. And the same thing applies to brain tumor. Now to the chemotherapy. Yes, for chemotherapy, I would say that there are side effects which comes with it. But generally, most of the brain tumors are not very sensitive when it comes to chemotherapy. They are not. So the result from chemotherapy is really poor when it comes to brain tumors. Generally, it's very poor. And you remember I mentioned something called the blood-brain barrier. So the
Yeah.
blood-brain barrier protects the brain. In this case, when a tumor is able to outwit it and enter the brain, unfortunately, it is difficult for the medication to cross the blood-brain barrier to go and hit the tumor. And that is why chemotherapy uh, is not very good as compared to other areas of the body. But in terms of brain tumor, it is not very good. And also, when it comes to radiotherapy, yes, there are some tumors which can be bent by radiotherapy, but radiotherapy also tends to have very devastating side effects. As we mentioned in the children, it can stunt their growth, completely affect their potential of growth, and they may end up being short. Um, in certain cases, it may even affect their hypothalamus. It may affect if the tumor is very close to your eyes. When they give radiotherapy, if they don't protect the nerve which supplies our eye, you may end up being blind. Um, in certain cases, if the surgery wound has not healed properly and they give radiotherapy, it can lead to burns around the area and the wound may not heal at all. And in some cases, we've also seen what we call osteonecrosis, where the bone which was taken to perform the surgery tend up being destroyed by the radiotherapy, and even normal bones around the area also getting destroyed by radiotherapy. So radiotherapy is not something that is very good for the brain and the nerves. But yes, again, uh, with advanced technology, we are beginning to have what we call radiosurgery, which is very focused. It's the target is precise. It does not go to other areas that it is not required. And all the radiotherapy, the high intensity radiotherapy is focused on the tumor and it is able to clear the tumor. So these new technologies in molecular genetics, in radiotherapy are all improving. So I'm sure you've heard something we call the cyber knife. A cyber knife is not really a knife that you hold. It's a form of radiotherapy. Or you've heard of what we call like radio surgery. So all these things are what is, and now with advanced robotics, you can map the brain. The brain is, I know I'm a neurosurgeon, but the brain is an interesting organ, and there is lot of activities around it around the world by medical engineers. We have government, especially the U.S. military, is pumping a lot of money into brain tumor and brain trauma research. So we have lots of technology which has been able to make things easy. Unfortunately, in Africa, we are lagging behind because uh, our government really are not investing so much. And sometimes it's also from even doctors who themselves do not believe, not neurosurgeons, but general practitioners who sometimes don't even believe that people could have brain tumors, have surgery, and can be treated properly. But maybe in the next 10, 20 years' time, when the African economy improves, we're going to have some of these things coming in. But of course, in Ghana, we have what we call the linear accelerator machine, which also helps in this focused radiotherapy. And thanks to God, we have one in Kolebu. But generally, neurosurgery across Africa is very poor because of the
Yeah.
long distance, the long years of training, and sometimes how expensive the machines that we need.
Yeah. Okay. We spoke earlier on about inheriting it from family members, like if it's
Yes.
genetic. What are the
Yeah.
chances of inheriting it? Like, is it from your immediate family, or can you get it from like a long distance family?
Oh yes, you can get it, but the so it has to do with molecular genetics. So if your grandparents had a gene, that you have a chance of getting that particular cancer. So there are certain cancers that, yes, when they are genetically linked, if of course, your chances are higher when your immediate relative have it. So your brothers or your sisters. If you are a twin, then one twin has the chances within identical twins is higher than fraternal twins, and then brothers and
Oh, okay.
sisters. So that's how it decreases. And there are some of the tumors too that may skip several generations. Maybe your great 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 grandfather had it, but it skipped several generations. Your parent may not even know that such cancers existed in your family, and then all of a sudden, boom, one person gets it again. So there are times it skips like 10 generations, and then one person gets it. So it can be common. And then, like I mentioned, the neurocutaneous lesions, those are also genetic, and they tend to have like some abnormalities or growth on the skin, and they also tend to have this tumor. But of course, if it's your half brother or half sister, um, or your aunties, your chances actually decreases. Your chances of getting the tumor actually is lower than your very
Yeah.
close relative. Yeah, but once we are at it and looking at the risk factors, then I must mention some. I'm sure probably it may come up during question. One has to do with ionizing radiation or radio frequency and the use of mobile phones. So yes, radiation can cause brain cancer, especially
Wow.
ionizing radiation. So those who have had radiotherapy before, like those with breast cancer or any radiation, especially to the head and neck region, it's have been shown that in about 10 years time, most of those people uh, can have brain cancer. So it's one of, and then there are certain viruses as well. Certain viral infection can also induce brain cancer as well. And then phone. When it comes to mobile phone, it is a very, 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 excuse me, controversial area, and really across the world. We need to do a lot to be able to determine the safety of mobile phones. But I must say that in the first study which was done to look at mobile phones, um, the conclusion was that the long-term usage of mobile phones do not pose a risk for developing brain cancer. But this particular study was also criticized by the fact that it had sponsorship from the mobile phone companies. So people felt that there was some bias, and there's been some improving studies across the world, which people have claimed that the use of mobile phone on one ear for more than 2 hours can put a person at risk of developing brain cancer in those regions. But I must say that these particular publications and studies are not well grounded in science, and we need to do a lot. But you know very well that the mobile phone industry is a very lucrative. They have a lot of money, and sometimes when science is dealing with a very strong economic force like that, it becomes very, very difficult. And in recent time, we heard about chloroquine, for example, which is one of the scandals which is just emerged. And this, we have two uh, bodies, including the scientists, who have been suspended. So from time to time, yes, we get these things coming up. But I think that, yeah, going forward, we need to do a lot to be able to really establish whether the usage, especially long-term usage of mobile phone, actually puts somebody at risk. But if I'm going to advise somebody whilst waiting to get that study done properly, I would advise that people should be very careful, staying very long on mobile phone uh, for more than 30 minutes. We should make sure that we don't expose our children to excessive mobile phone as much as possible. We should use the speakers and probably headset like that rather than putting the phone very close to you.
So thank you so much. I wanted to ask this question. With this brain tumors, we spoke about people getting headaches. How long does it take to be? How long can it go undetected?
It can go, like I said, up to about 10 years. It can go up to about 10
Wow.
years and you may not detect anything. For example, if you have the one growing under the brain, what we call the skull-based tumors, they can grow and grow and grow, and the very particular one which grow in the anterior skull base called the olfactory groove meningioma. There's so much space there. And when it starts growing, because it's very close to the nerve which supplies our sense of smell. That is the first thing you recognize. But there are many people uh, who will not even take it serious. Of course, if you can't smell that much, it's not a big business. Until COVID came, that we are talking about lack of smell, lack of. So a person doesn't really pick it up, and it gets to a time that then people begin to feel this person, even when cooking, she begins to burn food. Okay, and this is what, and sometimes still not occur at the first place, like their food is always getting burnt in the kitchen without knowing. If they are cooking rice, the rice get burnt and somebody have to like come and prompt them. This could go on for like 10 years without the person noticing that it is a tumor, and they would only come when the tumor has grown so big and is beginning to affect their vision, or they are beginning to have headache. And by the time they begin to have headache, the tumor has really grown big.
Okay. I think someone just joined in. We spoke about symptoms
Yes.
of the tumor. The person wants us to talk a little bit about some of the
A
symptoms
little about it. Yeah.
of the
So, like I
tumor.
said,
We're talking
the signs and symptoms depends on the age of the person. I will rush very quickly on it because we've spoken about it already.
yeah,
So for the child, you may have a white patch on the eye, and the child may be tilting one head to one side. That's for children who cannot speak, or the child may be having multiple falls, or maybe having imbalance when
yeah,
walking. When they are about 2, 3 years and they can speak, when a child who at that young age complains of headache, it is significant. It could be a tumor. The child may have problem hearing in one ear. Okay, and there are also children who could sit very well and eat, and then all of a sudden you put them down and they fall to one side, and they are always falling to one side. That is also a sign of brain tumor. And then for the adult, they tend to have headaches. When the headache is focal, it's at one place, it's so specific to that place. It is not the whole head. It doesn't change position. It's always at that place. That's what we
yeah,
call focal headache, and it is persistent. And it comes in the early hours of the morning, usually at dawn. And then when they wake up directly from bed, they begin to vomit. That is a sign of brain tumor. Now, when they vomit and they get better, it is a sign of brain tumor. And they're able to walk during the day as if there's nothing wrong, only for the headache to start again at night. So that is the typical brain tumor headaches. And then depending also on where the tumor is going into, it could occur in such a way that one eye may be protruding, or the person will be unable to close one eye, okay, or one part of the face would shift. So we call it facial palsy, okay. Or in some cases, when it's growing bilaterally, the patient may be unable to properly close the eye, you know, or when the tumor is growing around the brainstem, you may have difficulty swallowing, but that will usually start with choking. So the person may choke even with water, and it may be uh, may occur several times before the patient even realize that it is a brain tumor. Or you could have like a stroke-like symptoms where one part of the body become paralyzed or weak and you can't walk very well. These are all signs of brain tumor. And then, like I said, a single episode of seizure or convulsion in an adult who has never had seizures before, it is a brain cancer until proven otherwise. Yes.
okay. So someone is asking, what are the survival rates in relation to early signs of brain tumor?
Okay, so I would say generally, when the tumors are removed very early, the person could go on and live a normal life and will be killed by something else rather than the brain tumor. But there's one particular tumor, which we call the glioblastoma multiforme, which is the most devastating brain cancer that we know of. The one I mentioned, Ted Kennedy. It's been shown that in Africa, the first time the diagnosis is made, whether early or late, late is even worse. When it's the first diagnosis, the chances of survival or the survival rate is up to maximum 9 months. In centers where they have everything, it could go up to about 18 months. But after 18 months, the chances is very low. And then also, if it is a metastatic tumor, that is tumor coming from elsewhere, if the primary cancer has been dealt with fine, like breast cancer, okay, if you remove the brain tumor as well, the patient can also survive for a long period, more than 5 years, and may be killed by something else rather than the tumor. But if the cancer had already spread to the lungs, that is the cancer which has spread to the brain, had already also spread to the lungs and the liver, then the chances of survival is usually less than 6 months for those people. But as I said, generally, apart from the glioblastoma multiforme, the primary brain cancers, if they are well excised very well, we have more than 5 to 10 years survival.
Okay. Um, I think we've almost run out of time, and
Okay.
What we, what I want to say is, if you could wrap up and give us some advice, because most people get headaches through thinking, stress, and other things,
Mm-hmm.
which
Mm-hmm.
I think this continuous headache might lead to
Yeah.
these tumors or cancer. So, can you wrap up and give us some advice on how to prevent it, what to do, maybe how to live a healthy life?
Exactly. The brain needs you to live a healthy life. It needs you to live a healthy life, meaning you need to have enough rest. Okay, because as we mentioned, one other cause of brain cancer are some viruses. And viruses, when your immune system is low, the viruses thrive and they can cause these cancers. So you have to sleep very well and sleep early. And as much as possible, we should avoid radiations as much as we can. And this one, the atomic energy agencies really play a role, and we remember the case of the Hiroshima bombing and what happened to inhabitants of those areas. So governments and authorities must make sure that when we are citing uh, equipment with potential for spreading ionizing radiation, we must make sure that the people are well protected. Now, if you also don't sleep very early and you begin to have the stress and getting tension headaches and all those, it may not be tumor, but it is a stroke which will kill you because you eventually will develop hypertension. And this hypertension could lead to you getting strokes. So it's very important for us
Oh,
to get enough sleep. As much as possible, I won't belabor the point we've mentioned. The president of Ghana, for example, has mentioned us eating very healthy. We spoke about dawa dawa. These things are very important. That is what boosts your immune system. And as we've mentioned, most of these cancers can occur in weak immune conditions, including those with HIV/AIDS. Those with HIV/AIDS tend to have specific tumors which they
oh,
develop. So your immunity is very, very important when it comes to development of cancer. Even though, yes, your hereditary or your genetic inheritance can predispose you, but if you eat very well, you sleep very well, you reduce your chances of getting uh, these brain cancers. And when you get these signs, as much as possible, go and get yourself examined, okay? Including your eye. If you are not seeing very well in one eye or your vision is blurred, make sure that you are checked by a professional. You are checked by a professional so that, and the professional, when the thing is persistent and you realize that it's not a problem in the eye, as much as possible, this patient to get a scan done. So let's try and protect our brain. We should read more, keep reading. When you read, you develop your brain, and try to talk, try to exercise a lot. The moment you stop reading, your chances of developing certain brain conditions such as Alzheimer's disease or memory losses and shrinkage of your brain really goes increases. So as much as possible, we should keep reading, read as much as possible, and keep yourself very active. And when it is time for you to rest, you rest very early. And we should avoid alcohol. We should avoid smoking. These are um, also chemicals that put us at risk of developing cancers. So we should try as much as possible. And for those who believe in meditation, do yoga as much as possible, uh, I would encourage them to go ahead and do it. Yeah. And we should keep our eyes on our children. We should really, really keep our eyes on them. And when they begin to exhibit some of these signs and symptoms that I've mentioned, we should pick them early and send them to the hospital.
thank you very, very, very much, Doctor.
Thank
Thank you
you.
so much for your time. We've
Thank you,
really learned
Christy.
a
Yeah,
lot from you. Thank you
thank you.
so much for taking time. And we hope to have you again, educate us on
Thank you.
another
And
topic.
Thank you. Yeah,
And then
I've not seen you for a very long time. Hopefully one
I
day, yes,
know.
maybe when I come to England one day, or I come to Ghana, we'll meet. Yeah, but keep
Yeah.
doing the good work. Uh,
Thank
we
you.
pray that you're able to achieve whatever you set forth to do.
Thank you. Thank you very much. And thank you, viewers out there. Our time is up now and we have to go. Thank you so much for watching us. And then thank you once again, Doctor. Next week, same time, we're going to bring you yet another topic of Yes to Healthy Life. So see you next week, Tuesday, with yet another great topic. Bye.